Welcome to this training course on how to deliver healthcare remotely to your patients and communities and why it is important. I am Eniola Cadmus and with me is
David Adewale.
Together, we will be facilitating your learning experience. This training program has been developed following research and teaching collaborations between St. Francis University College of Health and Allied Sciences in Tanzania, the University of Warwick, and King's College, London, UK, and the University of Ibadan, Nigeria. The University of Ibadan, in collaboration with the Oyo State Primary Healthcare Board, has done the rich study, and the concepts we are sharing are based on our experiences during the conduct of the trial.
The training comprises of an introductory module and 7 other modules, modules 1 to 7. The training is interactive and with activities meant to ensure you are engaged and enjoy the experience. At the end of each module, you will have a short quiz. You need to pass at a minimum of 80%. Also, there will be an evaluation form. So give us a feedback concerning the module so we can use it to improve the delivery of the training.
In this introductory module, you will learn about the concept of digital healthcare as a broad concept and place remote consulting within it. We will also describe remote or mobile consulting, what it can be used for, and why it is important during the COVID-19 pandemic. Please keep in mind that remote consulting can be used even when there is no pandemic. During the course, think about how you might continue to use it once the danger from COVID-19 has passed.
What is digital health? Digital healthcare is an umbrella term. It is a little like saying hospital care. Hospital care tells you what category of care is being provided with, but nothing about which hospital, whether it is for diagnosis, treatment, or follow-up, nor which health discipline is providing the care. Digital healthcare is the same. It tells you the service is being provided via the internet, but nothing about who is providing the care and how and for what purpose. Digital healthcare can be high-tech, that is, can be done using sophisticated devices, or low-tech, that is, using the simple devices most of us and our patients readily have access to. And there are lots of services in between.
Examples of digital healthcare. A woman accesses an interactive website for advice about family planning. A man can send a text message to a clinic physician to request an anti-malarial prescription. A mother telephones the clinic as she is concerned her child is unwell but does not know what it is or what to do. A nurse contacts a patient with their test results. A pregnant woman takes her own blood pressure and uploads it onto a website where her midwife reviews it and sends her an SMS with reassurance. A community health worker phones a householder to check on their health or to follow up after they came home from the hospital. A teenage girl phones the clinic because she has severe abdominal pain. A nurse contacts a man living with asthma by phone to check how well his inhalers are helping with his breathing. A patient finds his blood sugar difficult to control, so arranges a video consultation with a doctor via a diabetes care website. Digital healthcare also includes use of artificial intelligence such as computer algorithms to undertake a diagnosis. In this training, we focus on providing healthcare through the use of your own and your patient's mobile phone. We call this aspect of digital health remote or mobile consulting.
What is remote health care? Remote health care is delivering health care when you are not face to face with patients. Patient telephones health worker. Health worker may be on a fixed device in the health facility. Health worker may speak with a relative.
Our definition of remote consulting is when a person with a perceived health need consults a healthcare provider using a mobile phone. They will use the internet or telecommunications infrastructure and will use smartphones to communicate. While mobile technology would usually be the means of communication, in our definition, we do include consultations using non-mobile technology. For example, a computer in a community center or a shared fixed phone line in a remote rural village. We also include the scenario where the person with a health need asks a relative or friend to assist them. We propose this expanded definition of remote consulting in recognition that communication technology is not yet widespread, and for some populations, these variations may persist because of a lack of resources or logistics.
At the peak of the coronavirus pandemic, the healthcare resources of almost every country in the world, COVID-19 was stretched. Remember, the infection led to a complex lung diseases with no current treatment at the time. Presently, management of the disease has improved and there are efficacious vaccines to boost the immunity of the population. COVID-19 pandemic physical distancing requirements are as seen in the diagram.
In Nigeria, an increasing number of people with coronavirus symptoms were reported as the epidemic unfolded. Once there were symptoms, people visited their healthcare facility. This obviously increased the risk of spread of the virus and overwhelmed the healthcare system, which already has a shortage of healthcare workers. The risk of population spreading of coronavirus, the risk to the healthcare workforce, the risk to routine healthcare delivery.
Remote delivery of healthcare will reduce this risk in two ways. One, suppose your patients do not have to travel to receive routine face-to-face healthcare, e.g., for diabetes, depression, or antenatal care. In that case, it will enable them to remain close to home and reduce their chances of coming into contact with the virus. 2. Similarly, for the health worker, the fewer people you physically contact each day, the greater the chance that you will not contract the virus. The risk to health workers from COVID-19 is severe. If the majority of people receive healthcare consultations remotely, then the limited resources, that is, personal protective equipment, PPE, will be properly utilized, and thus health workers will be safe.
Now, let's talk about other risks of face-to-face consultation. For example, if a health worker becomes ill, or worse still, they die, they cannot deliver health care, and the health needs in such communities grow. The risk of ill health and death goes beyond COVID-19, with people dying excessively of other conditions during the pandemic because they did not seek help when they started to become ill. Instead, they waited until they were seriously ill with a heart condition or an infection, by which time it was too late to save them once they did access the medical care. Remote consulting enables routine healthcare to continue. Vulnerable patients and families can be monitored, medications changed, and investigations ordered.
Now, why is remote consulting important during pandemics? An effective preventive strategy for controlling the spread of pandemic or any infectious disease requires physical distancing. To ensure healthcare workers can continue to provide for their communities' needs, they need to protect themselves from COVID-19 and other pandemics as far as possible. The risk to the healthcare workforce is minimized if they only see patients face to face when physical examination or treatment is essential.
Why is this possible? Our research on mobile consulting in low resource settings has identified great interest in digital health. Many African nations have digital technology strategies, and commercial providers have been enthusiastic in supporting healthcare delivery in these countries. Our research also identified that health workers, on occasion, did use remote consulting with their patients, but they had concerns. We will talk more about this in later modules.
Now, let's look at what makes remote consulting possible. Mobile phone ownership and access to mobile network is what we'll be talking about at this moment. A research in 2020 revealed that Nigeria had about 20 registered mobile healthcare providers supporting health care. The functional and consulting service providers in Nigeria include PriveDoc, Complete Care, Hudibia, High Clinic India, Health Tap, Tremendoc, Mobi Health, Med Africa Kenya, Health Connect 24/7, Docs, Reliance Care, Omomi, Sikh Med India, Dr. Now, and Nova Doc. These commercial companies are most accessible in urban areas and most affluent populations. Evidence from other low and middle income countries indicate that the use of digital and mobile communication technology for healthcare can improve management of communicable and non-communicable diseases. Ultimately, it has the potential of increasing access to healthcare services in low resource settings, especially when health systems are subjected to significant stress, such as COVID-19 pandemic and similar others. With the rapid expansion in the use of mobile communication technology in Nigeria, health consulting has a potential key role in improving access to quality health care.
Delivering healthcare remotely at speed due to the pandemic is not without its challenges, and these are just a few. The aim of this training is to enable you to understand and mitigate these challenges, embrace the opportunity, and keep yourselves and your patients safe. Some of the challenges include no regular internet access, the dilemma on ensuring ethical practice, unease about implementing diagnosis and treatment prescription, digitalized services, especially record keeping, is not widely available.
What can we use remote consulting for? Just to reiterate, it could be used for primary care and hospital outpatients, undifferentiated need, follow-up during acute episodes, monitoring and management of long-term conditions. In the community health care, it could be used to assess healthcare needs, providing advice on requests and in response to identified need, contact tracing, and of course, monitoring of community members with health problems.
What happens if the patient needs examination, tests, or treatment? As health professionals have started adapting to providing routine care remotely during the COVID-19 pandemic in Nigeria, doctors and nurses have found that they can largely meet patients' health needs via the remote consultation. Sometimes this may need following up by the patient. For example, collecting a medication prescription or attending for a blood test. Less often, this may require a physical examination. All of these eventualities can be opportunities for you to reorganize your care delivery. For example, you may need to think about how to arrange for prescriptions to be collected safely, or a blood test undertaken using personal protective equipment. More personal protective equipment may be needed when a physical examination is required to enable you to reassure the patient or escalate their care. The patient can be managed in the places that it would usually occur, but you will have the opportunity to manage it carefully to minimize infection transmission risks to yourself or the patient.
As we come to the end of the introductory module, it is clear that remote consulting can reduce the number of people that need to be seen face to face. For an individual patient, remote consulting can reduce the number of times they are seen. Some patients need to be seen face to face, but by accessing remotely first, it is possible to plan the face-to-face encounter to minimize contact time and infection risk. Remote consulting should be integrated with the existing health system.
You should now have an understanding of remote consulting and what it is, why it is important during a pandemic such as COVID-19 and other infectious conditions, and how it can be used and integrated within existing healthcare services. Thank you for listening. We hope you enjoyed the training.
Thank you.